Good afternoon. You're welcome to today's lecture on the course Introductory Pharmacology, GMP 123. So today we are going to introduce the course and see how far we can go. Okay? As I said before now, get ready because I don't play with my continuous assessment. I don't play with my continuous assessment. So get ready. From time to time, you're writing quizzes. Okay? I will send you the templates. Depending on the duration, how many weeks you have in this semester. Every week there must be a quiz. Every week there must be a quiz. So if we have 10 weeks this semester, that means we have 10 quizzes to write. So what it means is that you study back to back. There's no room for relapse. Okay? Alright, so the topics we are expected to cover for this semester. The first topic is terminology and importance of what? Pharmacology. Terminology is in pharmacology and importance of what? Pharmacology. The terminology is in what? Pharmacology and importance of what? Pharmacology. Today is what? So look at the terminologies and importance of what? Pharmacology. We also look at the sources and classification of drugs. Sources and what?
Classification of drugs.
Classification of what? Drugs. Then finally we look at preparation and administration of drugs. Preparation and what? Look at the preparation and the administration of drugs. So under each of these topics, these are the broad topics we're going to treat. Under them we have sub-topics. Things we are expected to cover under each of them. So, under the first topic, terminologies and the importance of pharmacology, we look at different terms, okay? Different terms in use in what? Pharmacology. We outline them and they explain them, okay? So that if you see them, you will not be confused. Am I communicating? So that's what we are going to do in the terminology. So we define each of these terminology terms, okay, used in pharmacology. There are many of them we can never in this small semester. How many weeks? Finish all of them, but at least majority of them to lay foundation for you to do more research on your own to find out more. Am I communicating?
Yes.
So that's what we are going to do. Then after that, we'll now discuss, look at the importance of what? Pharmacology. Why do you study pharmacology? Is there any need for pharmacology you are studying? Why as a community health worker, right? Extension worker, why do you study pharmacology? Is there any need for it? So the importance of pharmacology, we also look at the drug nomenclature. Under this, we also look at drug nomenclature. Terminologies in pharmacology, we define them, we list and define them. We also look at the importance of what? Pharmacology, and we look at the drug nomenclature, drug names, the three main names given to drug. We have the chemical name, the generic name and the brand name. So these are what we are going to discuss under this first topic, the terminologies and what importance of what pharmacology. So when we go to the next one, we take it off from there. So now let's look at the first terminology I want us to look at. You cannot talk about pharmacology without knowing what pharmacology is, right?
Yes.
So based on that, the first term I want us to look at is pharmacology. What is pharmacology? So the first term I want you to put down is what? Pharmacology. So let's start from there. Pharmacology. Actually, etymologically, the name pharmacology came from two Greek words, pharmakon. Pharmakon. Two Greek words, pharmakon. I can clean here, right?
Yes.
Good. I hope my camera have not moved it out of the frame.
No.
Good. Pharmakon. And what? Logos. Okay? Pharmakon and what? At least you are familiar with this from your secondary school, right?
Yes.
Logos means what? Study, right? Knowledge of, right? Good. Then pharmakon means drug or what? Or what? Poison. Are we together? Drug or what? Poison. Some even say charm. Charm. Drug, poison. As people, this is the one that concerns us, okay? Drug or what? Poison. So why logos is what? Study. So it's clear etymologically that pharmacology is the study of what? Drugs. So the big question now is, what do we now study about drugs in pharmacology? So in pharmacology we study the what? The origin. We start from what? The origin or the source of drug, the composition, what the drug contains, okay? Then the action of the drug, what the drug does in the body. Am I communicating? So in pharmacology, we also it also studies the what? The negative effects of the what? Drug in the what? The system. The effect. Hope you know that effect can be positive, it can be what? Negative. So pharmacology also studies the what? The effects of what? Drugs in the body what? System. So pharmacology is the science of drugs. It studies their what? Composition, the uses, toxicology, and it total studies their what? Action. Are we together? Are we together? Okay, I should call notes. Okay, I should call notes. I should explain you put down which one is better for you. I should call notes.
Just repeat it again.
Okay, I should repeat it again.
Yes, repeat it again.
There's something I want to tell you. So, the basic thing is to understand what I'm saying, okay? You can put it in a way that you understand it. When you open your book to do what? To study. Am I communicating? Yes. That's the basic thing is for you to listen, understand it first. Then you can put it in a way that when you now open your book to do what? To study, you understand it. Okay, now let me dictate something for those that find it difficult to put it in their own words. Alright. Pharmacology is the science of drugs. Science of what? Drugs. Including their what? Purity, composition, therapeutic what? Uses, action, and what? And what? The what? Effects. Okay? So you know that action is different from effect. Hope you know. Action is what? The action. If I take any action on you, is maybe I slap you, right? If I slap you now, that's the action, right? Now, that slap, did your eardrum burst? If your eardrum burst, is the effect of the slap, right? So that's why I say the action of the drug or the negative action of the drug, then the effects in the what of the drug in the what in the system. Are we together? So pharmacology studies all these things. It studies what? All these things. So if you now want to give, you can say put in flesh to make it look presentable. You can define pharmacology as what? A branch of medicine and pharmaceutical sciences. It's a branch of medicine and pharmaceutical sciences that is concerned with the study of drug action. It also involves the study of sources of drugs, the nature of the drug, the composition, properties, and the effects in the body system. Is a branch of medicine and pharmaceutical sciences that is concerned with the study of drug action. It also involves the study of the sources of drug, or the origin or sources of drugs, composition, uses, nature is under composition, and properties, final the effect in the body system or biological system, anyone. What's that? Any issue? If you have any issue, please call my attention. I think that is the right attitude, okay? Okay? The right attitude to class that if you have any issue, do what? Call the attention of your lecturer. So if you have any issue, if there's something you missed, let me know. I'll call it again. Okay? Don't keep quiet. Okay, so now if you look at the definition of pharmacology, we kept talking about drug, right? So now the next thing I want us to look at is what? Drug. The next thing I want us to look at is what? Drug. What is a drug? What is a drug? The drug is a chemical substance. The chemical substance that is used to do or to prevent cure disease, cure disease or ailment. That's talking about the same thing, you know. To prevent, cure disease, or to alleviate the symptoms of what? Disease. So any chemical substance that has the ability to prevent or cure disease, or even to the extent of what? Alleviating the symptoms of a what? Disease is a what? Is a drug. And basically, drug alter the what? The physiological what? System, okay? It alters the physiological what? System. Of course, before you can exert this function, you need to alter the what? So before this can be what? Are we together? So, at this juncture, I want to draw a line between drug and medicine. Drug and medicine are not exactly what the same thing. What you know? Are you aware?
Yes.
Are you aware?
No.
Okay, you aren't aware. Let me explain. Okay, now let me use what you know. You cook well, right? You cook well, right? Good. Now, drug can be likened, even if you want to prepare egusi soup, right? Egusi soup. Drug can be likened to the egusi itself. Okay? The egusi itself. Drug can be likened to what? The egusi itself. While the soup you prepare is the what? Can be taken as what? Medicine. Are we together? Are we together? So, if you want to prepare egusi soup, You buy a egusi, right? You process the egusi, you grind it, do all sorts of things, right? Then you have other ingredients you put together, right? You buy your fish, your oloko, your name them. You are oglope for those that use oglope. Another ingredient, your palm oil, right?
Yes.
Vegetables. And let's assume you gather all these ingredients and you refuse and you forget to put egusi. Is it egusi soup you cooked?
No.
It's not egusi soup, you know.
Yes.
So the egusi itself is the drug, or you call it the active ingredients. You call it the active what? Ingredients. The drug itself or the active ingredients. While the other ingredients you combine together, you join to the egusi to prepare the soup. It's called the what? Excipients. It's called what? Excipients. So in a nutshell, we have medicine. We have medicine. A medicine is composed of what? The drug, okay? Or the active ingredients, and what? The drug and what? Excipients. So the excipients are other ingredients that has one or two roles to play in the formulation. They are under what? Excipient. But the drug itself is what? The active, you can call it the drug or the what? Active what? Active what? Ingredients. All of them are ingredients too. But the drug is the active what? Ingredient. So medicine has the drug and other what? Ingredient. Am I communicating? So medicine is a drug product. Medicine is what? A drug product. The same way your egusi soup, the one you now eat, is the product you make out of what? Egusi. True of us, that's the one you eat. Now, if you go and carry the egusi, the raw egusi, and sit down, you just go to the market, buy 5 cups of egusi, and come home and sit down and start eating the egusi, or like that. Do you think you'll be okay after everything? That's what happens when people abuse drug. So these people you see abusing drug, is that drug itself is like some of these drugs that are prone to abuse, that one you take, you get high. You see them taking that drug like that. That's what's called what? Drug abuse. But when a standardized, a given quantity of the drug is taken and put in a formulation with other ingredients and prepare it, it becomes a medicine. That's the one that the one you will be given to maybe in the hospital or pharmacies to take for a particular what, to treat a particular what, disease or what, ailment. Just like as you see paracetamol now. Paracetamol itself is a drug. But we have paracetamol as a drug product. That's why you have paracetamol as tablets, paracetamol as suspension or syrup, paracetamol as injection. These things are medicine. Am I committing? Or you call it dosage form or drug product. The main thing inside all of them we have what? Paracetamol. So paracetamol inside them is the drug. That's what's called the drug. But that one that may be in suspension form, that may be in syrup form, that one is what? Medicine. Is it clear? So you rarely see people abusing medicine because the quantity they will put there is therapeutic what? Dose that will take care of a particular what? Ailment. If you now go and pack cartons of medicine, tablets of medicine and start it on your own, am I competing? So do you now know the difference between what? Drug and what? Medicine. So when you hear medicine, know that it's not the So then the same thing here. Yeah. Are we together? So now let's continue. So according to WHO, WHO defines drug as any substance or product used or intended to be used, any substance or product used or intended to be used to modify or explore the physiological system. To modify or explore the physiological what? System or pathological states. Physiological system or pathological what? States for the benefit of the what? Recipients. Hope you know the difference between physiology and pathology. Do you know? Do you know the difference between physiology and pathology? You don't know? You know? You know, right? Hey! Yeah! Whatever. You know the difference between pathology and physiology, right? Okay. Physiology is just the normal function of their system, okay? You know we have anatomy, it's just structure, okay? Physiology is how that structure functions of those structures. Now, but pathology talks about when this structure that are supposed to be functioning are not functioning well. They are either disease states or malfunctioning for one reason or the other. That's the pathological state. Okay. So pathology studies about this when it's not functioning the way it should function. Basically. Now, that's why I said here that according to the WHO, that drugs is any substance or product that is used or intended to be used to modify or explore the physiological system or pathological states for the benefit of the recipient. In other words, you can simply say that drug is any substance that which when taken does what? Alter the body's function. I think I mentioned it here. Alter the body function, be it physical, physiological, or even psychological. It goes psychological to what you know. Are you aware? Yes, some drugs are not just only physiological. It alters the body function physically. It can also do that physiologically. It can also do that psychologically. So anything that has, with the exception of food. My mind is not working. That's where I am. I think this man is giving what I want. Okay, let's continue. So, be it physical, physiological, or what? Psychological. Am I continuing? Anything, with the exception of food, though, food and water, okay? With the exception of food and water. Any other thing that can do that is a what? Drug. So it's when you now standardize the drug by, remember in your chemistry, you did chemistry and chemistry, right? Yes. Remember, if you want to standardize a particular chemical, what do you want to do? You want to check you want to determine the amount, right? Yes. So that's what you mean by standardizing. So once if you now standardize the drug, you now know the exact amount that you should take to prepare medicine. The patient will do what you take. That's the issue with most of these herbal Most of this concoction they carry about and call it herbal this thing. Most of them are not standardized. Most of them will just soak it, get the ingredient, get the active ingredient. That thing, when they soak it and take, what that thing they take out of it is what? The active ingredient. So when they take it, add honey and other things. Honey there is serving as what? Excipients, right? You see them, they won't even know how many milligrams of the active ingredient is in that thing. They don't know. They keep what? Selling it or taking it anyhow. But once it is standardized, at least you are sure of the particular number of milligrams. But not by the time we do calculation, we know that this course has. Are you aware that it has calculations?
Yes.
Are you aware?
Yes.
Okay, now. Towards the end, the last topic, there's calculation there. Yes. Alright, so if it is standardized, at least you'll be sure that this is the amount the patient is taking, whenever the patient takes the medicine. At least now, if you take a tablet of paracetamol, you know at least the milligram of paracetamol in one tablet, right? What's milligram? 500 milligrams. So if you take one tablet of paracetamol, at least you are sure you are taking what? 500 milligrams of what? Paracetamol drug. So that 500 milligrams is the amount of paracetamol itself inside that tablet. It's not the weight of the entire tablet. It's the paracetamol, the amount of paracetamol inside that what? Tablet. Are we together? Yes. Good. Okay, so I believe now you now know the difference between what? Drug and what? Medicine, right? Good. Even though people use the two terms what? Interchangeably. Even though people use it interchangeably, but I want you to know as a professional that they are not what? Exactly what? The same thing. Okay? Okay, now so let's continue. So another term I want us to look at is what? Drug dependence. Drug dependence. Drug what? Dependence. Drug dependence. So, what do you understand by? Have you heard of that term before? Yes. So, tell me, what do you understand by the term dependent? Any idea? Huh?
Individual that depends on drugs.
You are still using the same term. You cannot be. You can't use depend to explain dependence for me.
Individuals that takes drugs.
Individual that
takes drugs. Regularly takes drugs.
Okay. Anyway, okay. Thank you.
Drug dependence.
What do drug depend on to make it active? Okay. Let's see another person.
What drug rely on that when it's not there, it's
Okay. Any other person? Okay. Okay. Right. Okay. You all try. Let's see what we can make out of this. There are people that they are used to a particular drug. Maybe they actually, it's not that they are abusing it. Maybe the person has a chronic disease for a long time. Maybe diabetes for over a long period of time. The person is used to this particular drug. That in fact, this person, without teeth, the person may feel as if, in fact, cannot stay without even taking that drug. Am I complicating? There's a thin line between, by the time we go over to drug addiction. If you're not careful, you may somehow interchange drug addiction with what? Drug dependence. There's a thin line between them. When we go into drug addiction, then I'll throw more light on that. But for now, I want you to understand that drug dependence is a strong desire or sense of the need to take a substance. Basically, drug dependence is a strong desire or that sense of composure or the need to take a particular what? Substance. Am I communicating?
Yeah.
Now, even if in fact the person cannot even control the taking that particular what? Substance or drug. Even if it's obvious to the person that this thing will harm you, the person can still not do without what? Taking that particular what? Drug. Am I communicating? So they say that if you now want to withdraw the person, or if you want to stop the person from taking it, the person will a conglomeration of signs and symptoms we call withdrawal syndrome will come up. Am I communicating? Yes. There are some drugs that are not prone for addiction. It's not inherently on their own to be that there's some drug on its own, on their own inherently that this because of their activities they are prone to what? Addiction. That one is different. I'm not talking about addiction. I'm talking about normal drug people take, but because of long-term use and depending on psychologically in our education, you feel that without it you cannot do what? Do without what? Taking this particular drug. Am I communicating? That's what we mean by what? Drug what? Dependence. Is it clear?
Yes.
Good. Now, another time I want us to look at is tolerance. Remember, we started with what? Pharmacology. When is there? Okay, no, I'll ask you. We define what? Now talk about
Drug dependence.
dependent. Another one is next one is what? Tolerance. You know, under normal circumstances, if you take a particular drug, if you take a particular drug, it should elicit a particular therapeutic effect, right? Good. And the more you take it, the more effect it has. True of us. Good. It will be taking care of the effect. But it will get to a point whereby if you take the normal dose you have been taking, it will not have any effect on you. And before you now have the same effect it was having before, you need to increase the what? The dosage. If you get to that level, it's called what? Tolerance. Okay? If you get to the level, it's called what? Tolerance. So tolerance happens when a person no longer responds. Tolerance occurs, or it's a situation whereby a person no longer responds to drug the way he did the first time he took the drug. Am I communicating? No longer respond. I say that tolerance occurs or is a situation whereby a person no longer responds to the drug the way he did when he first used the drug. So in order to get the same effect or to have the same response, the person has to do what? Increase the dose. So higher dose will be required to do what? Get the initial result. Am I communicating? And that is how you keep increasing the dose. You keep increasing, and it may increase today. You may be at level 2 today and keep using. At a point, you will not be getting the same effect. You do what again? You keep increasing. You keep doing what? Increasing. And remember, drug has its own what? Therapeutic effect and side effect, true or false. So the more you increase the dose, the more you increase the what? Adverse coincide what? Effect. Okay? Remember that. So any question? Any question? What's time?
After
2:14. Okay. Remember this is supposed to be introductory class, but since I am already digging it. But it's okay. It's okay. Let's see how far we can go. Okay. So now I want to point out something. This tolerance develops more when you use drugs like opioids. Opioids. You know what opioids are? Opioids. Cannabis. Benzodiazepine. Don't worry. You get there. Don't worry. Opioids, benzodiazepines. You know you have the diazepam, right?
Yes.
It's under what? Benzodiazepine, okay? You know you have nitrazepam. You know them, right? They're under what? Benzodiazepine. Cannabis, you are what? Igbo, right? The more you take, the more you increase it, the more you want more. True of us?
True.
Once you enter, you don't enter. Once you enter, you don't do what?
Yeah.
So don't even try to enter at all. And even if you try to withdraw, you start behaving as if you are sick. Because you start behaving as if the person is sick. True of us? And it will take time to recover. If at all the person doesn't go back again. No. Alright, so you see people think that in fact, I've seen people, they will come, people will go to the extent. People go to the extent of what is that? Abusing even medicine in search of drug. I remember when I was working in community pharmacy, you see them, they come. They say, they will tell you that, we have cough syrup. There's cough syrup, ordinary cough syrup, without codeine, just plain. We have the one that maybe diphenhydramine or chlorpheniramine based, depending, plus codeine. That one without codeine. They will come. They will say, I did to them now. They go to me and say, sir, I want cough syrup. I say, wow, cough syrup. Okay, I'll go and get the one without codeine. Once I see them, I know them. I'll get the one with them. They say, no, I want the one with codeine. I have a very, why do you want to use the one with codeine? So I have a very hard, very strong cough. I will hold the person and engage the person in discussion. I will just be discussing for like 5 minutes to see whether the person will cough. I will just be close to the person, I just engage the person. You will know what I'm doing. After 5 minutes, he says, sir, I say, please. I said, you don't have cough now. He said, seriously, I have cough. I said, serious cough. And for the past 5 minutes, you not cough. I will say, please, I will not give you any cough syrup with codeine. What they're looking for is that codeine. But they want to feel high. They have, because they have, in fact, they cannot stop it again. Do you know what they do? They come and pack like up to 5 bottles. As at 2013, that cough syrup was around 800 naira. Only God knows how much they're selling it now. But they will pack up to 4 bottles. Do you know what they will do? Our normal cough syrup will take 10 ml. Once they read the pharmacy stamp, they open it. They will go. They will leave your bottle, and disappear. Is that codeine they are looking for? Problem. So this will lead us to what? Drug addiction. Okay? Now let's look at what? Drug what? Addiction. I want to point out that tolerance, that dependence has a link. Tolerance has a link. What? Dependence first. Tolerance has a link. Okay? When the tolerance increases to some certain extent, the person becomes what? Dependent on it. Am I completing? So dependence develop due to high what? Tolerance. Know that point. Put it under what? Dependence. That dependence develop due to what? High what? Tolerance. Because your body has now done what? Adapted to the what? To the drug over a long period of time. All together. So dependence develop as a result of what? High what? Tolerance what? To a particular what? Drug. Okay? Now, what now is addiction? What is addiction? Actually, addiction is a disorder on its own. Addiction on its own is a what? Serious disorder. Am I communicating? In fact, it's a disease. Hello? Hi. In fact, I can comfortably tell you that addiction on its own is a what? It's a disease. It's a serious problem. Okay. So, drug addiction is a disease that affects the person's brain and behavior. That affect the person's brain and what? Behavior. And it leads to what? Inability to control the use of what? Drug. Things like nicotine. You know, nicotine, what's that? Hello? Hi. Please, if you are not able to pick anything, don't be doing. It's not the right attitude, okay? Call my attention, okay? Okay? Because if you do that thing finish, and without calling my attention, you keep doing it until the lecture ends. And you say, I'll copy from my classmate. Forget that thing. You may not copy it. Are we together? I remember what I was teaching in school, in secondary school, university level. That affected me. Sometimes I may just leave a space. I say, I will. Forget that thing. I will not do it. So as in the hot, once you mix, please come and attention here, please. I beg you. All right. So I said that is a disease that affects a person's brain and what? Behavior. And it leads to inability. So it's a vicious circle, in fact. It leads to inability to control the use of what? Of a drug. Am I communicating? Drug like nicotine, marijuana. You know people that are you aware that people can get addicted to cigarettes? True or false?
Yes.
There's addiction there. Do you know what they're addicted to?
No.
Nicotine inside that cigarette. Is that nicotine in the tobacco? That's why you put that nicotine here. Is that nicotine inside the tobacco? That's what they are addicted to. Every time they want to smoke cigarettes. And that one is even more dangerous. Even than what? Cannabis. Are you aware? In fact, they will package, they first started telling us that tobacco smokers are what? Die young. We didn't want to listen to them. They now went back again. They said the federal minister of health warns that tobacco smokers, blah blah blah, nobody listen to them. They now went back again. And if you see the packet now, you will see two lungs.
Yes.
The healthy lungs and the what? Destroyed lungs. They will draw it for you there. People don't even look at that one. To tell you how addicted. Huh?
They're writing on distance.
You say what?
Why are they still producing it?
No, it's not. The law has not said you should not produce. Am I correct? You know, remember we have moral. We have morality and we have legal. Hope you know. There are some things that are not, that may you morally bad, but legally they are not bad. Am I correct? Like you see something like sex now, premarital sex. Morally, before spiritually, hey, is what? Is a sin. It's a mortal sin, right? But legally, so far the two people agree, you're on your own. So far the two people involved agreed. There's nothing wrong there. That's legally okay, but morally it's not there. The same way now, morally you know that there are some people, because they are into evangelism, they stop selling. Maybe they stop selling cigarettes because morally they know that it causes damage to what. But legally, so far the law has not banned it. You cannot do anything about it. They only tell you what the government say. That this. So if you are taking your own, am I communicating? The same thing with alcohol. There are some religious groups that say alcohol. But what they will tell you that if you are below 18, legally, don't take. Legally, they put it for you there. 18 plus. They will tell you drink responsibly. But morally, some religious groups say that you don't even test it, let alone taking it responsibly. So they're taking between what? Morals and what? Am I communicating? So that's why even they have done their own by putting it on the packet that this is what is left for you if you want to do. You don't want to do. This fight in some different countries, they're talking about legalizing abortion and not legalizing abortion. The simple thing there is that what it means is that if you abort, legally is nothing, you not commit any crime. That's the meaning. If a country legalizes abortion, what it means is that if you do abortion, you cannot walk in any hospital and say, I want, the same way you say, I want to buy paracetamol, I want to do abortion, nothing. Okay, don't worry, come. If they do it, normal. Legally is nothing wrong, but morally is wrong. Am I communicating? And so that's what I'm. The same way that some people have legalized same-sex marriage. It's not that they will force you to marry, but if you decide to marry, you can openly get married. Nobody will question you. But morally is what? Is wrong. Okay. So let's know the difference. So that's exactly what happens here now. Am I communicating? Because if it's banned in Nigeria, they will not be selling it. People will not be carrying it up and down. Okay? But things like Igbo cannabis, you can be arrested, hope you know. Are you aware?
Yes.
Are you aware?
Yes.
Officially, it's not legalized in Nigeria. True of us. They can come in to where you are. You cannot just carry it anyhow, go to do what you like anyhow. Even though this is, I don't understand the game. But that's what it is. Please, let's continue. So I mentioned marijuana and what? Nicotine, okay? Yes. Of course, you don't be told most of this drug prone to addiction. Addiction causes what? Both psychological and physiological and physical harm. True of us? Yes. Psychological, physiological and what? Physical harm. Dependent. Nicotine alone, taking it now, you see what it can do to your what? Lungs, right? Is that not physiological harm? It is. True of us? Okay. Okay, so that's what we mean by what? Addiction, okay? That is a more serious thing now, okay? Not all drugs are prone to addiction. Am I competing? Yeah. But the normal drug you take, someone may become dependent on it. Especially if they treat long-term chronic what? Diseases. Mainly, there are the people that are exposed to this what? Dependence. Those that have chronic issues. Name them: hypertension, diabetes, arthritis. These people they are on one drug for a long time and they become dependent on it. Okay, now another time I want us to look at is what? Synergy. Synergy. Let me explain what we mean by synergy. Sometimes you may see two drugs may be formulated in a particular medicine. Have you seen it before?
Yes.
Two drugs may be formulated in a medicine. Two or more Artemether, lumefantrine. These are two drugs that are in one tablet. Okay, you may see something like ampicillin, clorazicillin, ampiclos. Two drugs in one tablet or in one injection. True of us? You see something like there are many of them. So that is good. You see them. They want to achieve synergism. Synergy. Now, what happens is this: when these two are in one, two of them will attack the bacteria. The effect, their combined effect against bacteria will be more pronounced than their individual effects on the bacteria. Are we together? Are we together? If they are together, you use them simultaneously, they attack. As this one is attacking this, their combined effect will be more pronounced when you use this one first, then after you use this one. The effect will not be there. So the combined effect will be more. The effect will be more when they are used. So that's what we mean by what? Synergy. Are we together? Synergy or synergism, as the case may be. Synergism. Any of them? Synergism. Okay. So synergy or synergism, as the case may be, is the interaction of two or more drugs. Synergy or synergism is interaction of what? Two or more drugs to produce a combined effect. To produce a combined effect that is greater than the sum of the individual effects of the drugs. Okay? Synergy or synergism is the interaction of two or more drugs to produce a combined effect greater than the sum of the individual effect of the what? Or individual effect of the what? Of the drugs in question, okay? Good.
You say some kind of sum.
Sum, as in addition. In your septrim, we have two drugs in Septrin. Are you aware? In Septrin, the ones in Septrin you know. You are Cotrim, Mozazole, you know. It has two drugs. One is what? Sulfur methoxazole and trimethoprim. It has two drugs. The Septrin has two drugs. Sulfur methoxazole, sulfur methoxazole plus what? Trimethoprim. 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 Sulfur. We have named our 5 here, right? The one you know, you will name alternative. Name many of them here, right? So most, if you drug medicine has 2 more ingredients, especially maybe anti-malaria, they want to achieve what? Synergy. Okay? You don't want to give the chance to resist. Okay? This one is attacking this side. This one is attacking this side.
Yes, sir.
So, I think we'll continue next time. I want to. Anyway, I'll find out. But do you have any idea of when your exam will come? Okay. Don't know what I'll find out from this. Who among you here that is not in the group? You know, group? Click. If you drop the link in your personal group, click on that link and join. Okay? Simple. Just you join. Simple. Okay. It's phoneless. Now, 3K. If I say it's well, I got the same model. One bell.
So there is one other person, but the person is not in school.
Okay, what about the person called? Let the person join. From time to time, I host online classes. Time to time, I host online classes. So if I will do that, I'll drop the link in the group. Okay?
Okay, sir.
Anytime I'll do that, even if you ahead of time, I'll link in the group. That's why I have the work, the group. I drop information. Anytime maybe one thing or the other may make me not to be able to come, or in a quest to cover, okay, I'll combine both online and online. So and remember I said every week quiz. So the quiz we are going to test this depending on how weeks we I'll find today if I go. Number of weeks will determine the number of quiz we are going to have. I want to stop because I have tutorial at 4 p.m. so I wouldn't want to keep my students waiting. So you can also join the tutorials. It's live on TikTok. This is mainly O-level, mainly jam O-level is 4 to 6 p.m. every day, except Wednesday. For now, Wednesday and Sunday are not inclusive. Jam. But I use that money for other things if I have the strength. But Tuesday, Thursday, Friday, Saturday, 4 p.m. live. Yeah, that's in jam. Is Okay, sorry, my name is Pharmacology the school board. Pharmacology the school board. Let me write it. What's to TikTok? Just search for. But this is at. Let's do that at one. Pharmacology 83. This is user, okay. But if you search Pharmacology, the schoolboy is there. Just go for Google it on Google, anything, anywhere you want to install. I'm on YouTube, Facebook. I'm everywhere. Go to TikTok. TikTok. Instagram. Instagram, Twitter,
To go.
LinkedIn,
Yes,
LinkedIn,
Snapchat.
Facebook, Snapchat, thank you. Facebook, what else? YouTube. At least for now. That's it, but the places you see my full lecture is YouTube and Facebook. Mainly YouTube. That's where you see full. What you see, other places just short clip. Yes.
But you're not like for YouTube.
Huh? But my live is on TikTok.
By 4.
4 p.m. 4 to 6 p.m. Between 4 and 6 p.m. So I think we have physics today. All right, I will stop here. Okay.
Yes, sir.
Why I gave you this information is that I know that a lot of things happen on doing movement from O level to this place. There are some people that have a lot of valleys to feel. So even if you cannot come physically, at least you can join online to help you to fill up those valleys. Because there are a lot of things that you will meet in that if you miss some things in your O level, it will be affecting you. Yes. All right. Thank you very much for your attention.
So that mathematics competition, is it free registration?
Okay, mass competition. Okay, yeah, the academic battle. No, it's 500 naira registration. Registration is 500 naira. So if you are interested, then. Huh? Yes. Mass competition. No, not only mathematics. Chemistry, physics, different subjects. Pharmacology, different subjects. But it just next one now is mathematics. So after mathematics, next subject. All right. Thank you very much. See you. On the normal, we shall. The title is Mondays, right? That Monday is somehow. All right, thank you. God bless you.
Thank you, sir.
Okay, what's that?
Can you give us a
Handout. If you are in my class, take note in my class.
Thank you.
Take note in my class. Simple.
Thank you.
Come to my class and take notes. Come to my class and do what?
Thank you.
Then if you miss anything, you can always watch. I will upload this. I upload my lectures. But if let's assume I come across anything I think you may need, maybe I always drop it there. If I come across anything, any material I think you need, I'll help you. I'll drop it. But basically, come to my class and.
Thank you.
All right.
Attendance, sir.
Okay, I forgot. It's good. It's good. I will not forget it. Oh yeah. Okay, I'll call your name right.